NCLEX RN PDF 2026 questions to study anytime and anywhere easily. Question 1. A female client is receiving 4-mannitol. An assessment specific to safe administration of this drug is: Option A, a vital signs Q4H. Option B, weighing daily. Option C, urine output hourly. Option D, a level of consciousness Q4H. The correct answer is option C, urine output hourly. Mannitol is an osmotic diuretic. Hourly urine output monitoring is required to ensure the kidneys can handle the fluid shift and prevent heart failure. Question 2. What is the primary advantage of using a pen-like insulin delivery device over traditional syringes? Option A, accurate dose delivery. Option B, shorter injection time. Option C, lower cost. Option D, use of a smaller gauge needle. The correct answer is option A, accurate dose delivery. Insulin pens are designed for high precision in dosing, which is their primary clinical advantage over manually drawn syringes. Question 3. To assess for damage to major blood vessels from a fractured tibia, the nurse should monitor for: Option A, swelling of the left thigh. Option B, increased skin temperature of the foot. Option C, prolonged reperfusion of the toes after blanching. Option D, increased blood pressure. The correct answer is option C, prolonged reperfusion of the toes after blanching. Capillary refill, reperfusion, is a direct measure of peripheral arterial blood flow. A delay suggests vascular damage from the fracture. Question 4. A 65-year-old man is admitted for spinal stenosis surgery. He lives alone in a 2-story house. When should the nurse initiate discharge training and planning? Option A, following surgery. Option B, upon admission. Option C, within 48 hours of discharge. Option D, preoperative discussion. The correct answer is option B, upon admission. Discharge planning should begin upon admission, or even preoperatively, to ensure all home care needs and potential barriers are addressed early. Question 5. A 5-year-old child appears hesitant to play and frequently asks if it is okay to play with certain toys. Which Erikson stage is the child primarily navigating? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option B, initiative versus guilt. Children aged 3 to 6 years are in the initiative versus guilt stage. Excessive hesitation or seeking permission may indicate a struggle with guilt over self-initiated play. Question 6. A 26-month-old toddler is becoming increasingly assertive, wanting to dress themselves, but becomes frustrated and ashamed if they fail. Which Erikson stage is this? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option C, autonomy versus shame and doubt. Toddlers, 1 to 3 years, are in the autonomy versus shame and doubt stage, where they strive for independence and self-control. Question 7. A 20-year-old young adult expresses concerns about a recent breakup and feels isolated from peers. Which Erikson stage is the young adult primarily navigating? Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame. Option D, intimacy versus isolation. The correct answer is option D, intimacy versus isolation. Young adults, 18 to 40 years, navigate intimacy versus isolation, focusing on forming deeply personal relationships. Question 8. Which of the following vital signs taken during a school health fair appears to be outside the typical range for the respective age group? Option A, the 11-year-old athlete, 90 BPM, 22 RPM, 100/70 mmHg. Option B, 13-year-old female, 105 BPM, 22 RPM, 105/50 mmHg. Option C, 5-year-old male, 102 BPM, 24 RPM, 90/65 mmHg. Option D is 6-year-old female, 100 BPM, 26 RPM, 90/70 mmHg. The correct answer is option B. 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. For a 13-year-old, a diastolic blood pressure of 50 mmHg is lower than the typical range, especially alongside a slightly elevated heart rate. Question 9. A 38-year-old female struggles with depression and an anxiety disorder. Which of the following medications is most likely prescribed for these conditions? Option A, amitriptyline, Elaval. Option B, calcitonin. Option C, pergolide mesilate, Permax. Option D, verapamil, Calin. The correct answer is option A, amitriptyline, Elaval. Amitriptyline is a tricyclic antidepressant, TCA, commonly used to treat depression and sometimes off-label for anxiety.